तो हम लोग बात कर रहे थे कि व्हाई इज ओरल हेल्थ इंपॉर्टेंट। प्लीज एक बार हमारे ऑडियंस को दोबारा बता दीजिए, क्योंकि लाइव सेशन थोड़ा सा ब्रेक हो गया एंड
No problem.
या
Saying that the oral cavity is the gateway to the entire body. So if we eat healthy, if we maintain our hygiene, the overall health gets affected. All of us regularly get our medical tests done once a year, but how many of us even visit a dentist to get a complete dental checkup done? So as a rule, one of everybody should go every 6 months and say hello to your nearest dentist. And through you, Raman, I would like to tell all your millions and millions of followers that you're most welcome to come to any Clove Dental, and you can take Raman's name, and I'm sure you'll get amazing discounts at any work that you would like to help you with.
ग्रेट ग्रेट ग्रेट। सो गाइज, उम्मीद है आप लोग जल्दी विजिट करेंगे क्लोव डेंटल के स्टोर में। अगर आपको कोई सी भी प्रॉब्लम है, एक छोटा सा चेकअप भी कराना है, तो भाई वेट मत करो, अभी के अभी चेकअप करा लो जाके, क्योंकि ओरल हेल्थ प्रॉब्लम बाद में बढ़ जाती है और बहुत ज्यादा परेशानी देती है। तो अगर हम उसको अभी से ध्यान रखना स्टार्ट कर देंगे तो बाद की जो प्रॉब्लम्स है वो हमें फेस नहीं करनी पड़ेंगी। ठीक है, तो मैं आपसे पूछना चाहता हूँ कि जो मोस्ट कॉमन हेल्थ रिस्क है ओरल हेल्थ के, वो क्या है?
So basically, you can divide them into two categories. One is hygiene related and one are habits. So if we maintain hygiene, suppose if we are brushing, if you're not brushing, if somebody does not brush regularly, properly twice a day, or does not rinse the mouth, you will have the oral cavity is a house to millions and millions of bacteria, which are healthy and good bacteria. But there always is a balance that needs to be maintained. If the balance gets disrupted, then there is disease which sets in. So there can be infection, there can be pus. So many people come and say, मेरे को bad smell आती है mouth से, my gums hurt, my gums bleed while brushing. So common. But how many of us actually go to treat it? We don't realize that this is the sign that our body is giving us that there's a problem and we should, go and get a checkup done. And the infection, it's a myth that people say that, infection, it's such a small thing, मुंह में ही तो है. But if you actually realize oral cavity is connected to our entire body, पूरा the whole system, God has made it so beautifully कि everything is interconnected. अगर आप ऐसे देखो, अगर आपको सिर्फ मुंह में इन्फेक्शन होता है, it will be very interesting to know that it puts a lot of our organs at risk. आपका सिर्फ मुंह का इन्फेक्शन आपके हार्ट को इफेक्ट कर सकता है, आप जो डायबिटिक्स होते हैं उसको ऑफ द बैलेंस थ्रो कर सकता है, आपकी किडनीज इफेक्ट आती हैं, द इन्फेक्शन कैन गो टू द जॉइंट्स, सो इट कैन बी अ कंप्लीट it's a complete network. So you cannot and not ignore your oral health at all. And the other part of the question is the habits. So if somebody has tobacco chewing habit, so you have smokeless tobacco, that is the pan masala and the tobacco that we chew. Other is smoking. So there can be a lot of detrimental and bad effects to doing habits or using tobacco, which can cause so many oral diseases. And it can completely affect our systemic health. दिक्कत कहीं भी हो, होता है फिर.
तो हमारे पास यहाँ पे कमेंट्स आ रहे हैं कि ब्रेसेस के बारे में क्या ख्याल है, व्हाट्स देयर कॉस्ट?
So if we talk about braces basically क्या करते हैं, जिनके दांत टेढ़े मेढ़े होते हैं या होते हैं, तो braces treatment or aligners also for that matter, which you have, which is the latest advent, they help correct your equilibrium and balance of your teeth. Now अगर टेढ़े मेढ़े दांतों को आप देखो तो आप उनको ना ब्रश कर पाते हो अच्छे से, खाना जमता रहता है, getting dirty very quickly. अगर इसी को आप ब्रेसेस या अलाइनर से बिल्कुल सुंदर से आंच में ले आओ तो आपके दो बेनिफिट्स होंगे. वन, योर स्माइल इज गोइंग टू बिकम लाइक रमन, बहुत ही एंड स्पार्कलिंग.
थैंक यू सो मच.
एंड सेकेंडली, आपके जब दांत सीधे होंगे तो नॉट ओनली द एस्थेटिक पार्ट और द ब्यूटी पार्ट बट ऑल्सो द फंक्शनैलिटी विल कम इनटू प्ले. It will get corrected and you'll be able to chew and bite better. And nowadays we have advanced braces. So earlier it used to be said, children who are in school or college should get treated. But now with advanced braces, You can treat any age group. Age is no longer a bar to treat malaligned teeth. It's called malocclusion, the टेढ़े मेढ़े दांत.
तो एज की आपने बात की है, तो एज से मैं आपसे पूछना चाहूंगा कि इसकी जो माइनर मतलब सबसे कम एज और सबसे ज्यादा एज हम मतलब अपने दांतों पे कब एक्सपेरिमेंट करा सकते हैं, मतलब कब हम मतलब व्हाट इज द मिनिमम और मैक्सिमम एज क्या होनी चाहिए इसकी?
Okay, so the minimum age when a patient should visit a dentist is जब आपके मुंह में पहला दांत आता है. That is at 6 months. At 6 months of age, you should visit the dentist the first time. And
ओके.
what is the upper limit? Age is no bar, because आपका first milk dentition होता है, दूध के दांत होते हैं. उसके बाद आपका permanent आता है, and जब वो गिर जाता है तो people used to wear dentures, जो नकली दांत होते हैं. So now we have replacement options of dental implants. तो जिसके मुंह में कोई भी natural दांत नहीं बचा है, हम उसे implants के सहारे we can give you a fixed dentition. So milk teeth, permanent teeth, and implant supported teeth. So there is no upper limit, but the minimum age is 6 months.
ओके. सो मेरा नेक्स्ट क्वेश्चन है आपसे, डायबिटीज जो हमारी मोस्ट कॉमन प्रॉब्लम हो गई है, मतलब ऑलमोस्ट हर घर में मेरे को मतलब अगर एक बिग फैमिली है तो हर एक फैमिली के अंदर एक डायबिटीज पेशेंट मिल जाता है, ठीक है. मोस्ट प्रोबेबली चांसेस होते हैं कि उन लोगों को बहुत बार पता भी नहीं होता कि उनको डायबिटीज हो रही है, बट उनको होती है. सो इसकी जो व्हाट आर दी गुड ओरल हाइजीन हैबिट्स, इसको रिड्यूस कैसे किया जाए?
So diabetes is a condition in which the blood sugar level becomes very high in the body. ठीक है, तो जब शुगर लेवल बॉडी में हाई होता है तो आपकी जो हीलिंग कैपेसिटी है वो बहुत रिड्यूस हो जाती है. तो अगर आप उस टाइम हाइजीन नहीं मेंटेन करेंगे तो आपको मुंह में इन्फेक्शन होने के चांसेस बहुत ज्यादा हैं. और अगर इन्फेक्शन हो भी जाता है तो वो जल्दी से ठीक भी नहीं होगा, बिकॉज हीलिंग इज वेरी वेरी डिलेड. And there are studies which have shown that if you maintain good oral hygiene and good oral health, the medication जो आप अगर आपने कभी देखा होगा डायबिटिक्स में पूरी लिस्ट होती है, इतनी सारी मेडिसिन होती हैं, तो उसमें से आप 3% मेडिसिन रिड्यूस हो जाती हैं अगर आप अपने शुगर लेवल्स को शुगर लेवल्स आपके ऑटोमेटिकली, आई विल नॉट से कंट्रोल में आ जाते हैं, बट जो ऑफ द रेंज कंप्लीटली जा रहे हैं वो थोड़े बेटर हो जाते हैं बिकॉज ऑफ यू हेल्पिंग टू मेंटेन ओरल हाइजीन. आपके बॉडी पूरी इन्फ्लेमेशन होती है, जो डिलेड वूंड हीलिंग होती है, all that can greatly be controlled and kept into balance if your oral hygiene is maintained. अगर कोई डायबिटिक है फॉर एग्जाम्पल, जिसका बहुत ही पुअर ओरल हाइजीन है, उसकी शुगर कंट्रोल में आने ही नहीं वाली है. अगर एट द सेम टाइम अगर आप उसका ओरल हाइजीन बेटर कर दो, उसकी गम हेल्थ बेटर कर दो, तो वो अगर 5 दवाइयां ले रहे हैं तो कम से कम उनकी 1 या 1.5 मेडिसिन कम हो जाएंगी एज अ रेगुलर डेली इनटेक. So it totally has a very great impact on your overall health. That is what I was just trying to bring about in people.
got it. So basically गम्स की बात हुई है यहाँ पे, तो मैं आपसे पूछूंगा कि रिलेशन बिटवीन ब्लीडिंग गम्स एंड ओवरऑल हेल्थ, इसी का आप मेरे को अभी एग्जांपल दे रहे थे.
हाँ जी.
तो
So what happens is, sorry.
Yeah, you continue.
So what happens is when you brush or you eat an apple, as you see in the ads, जो उसमें bleeding होती है, that's the first sign that your body is giving you that problem है. Please visit a dentist. Go show to a dentist. But lot of us
मतलब अगर उस टाइम पे किसी ने इग्नोर कर दिया तो उसको प्रॉब्लम स्टार्ट हो जाएंगी.
प्रॉब्लम है स्टार्टेड ऑलरेडी. अगर ब्लीडिंग हो रही है
मतलब प्रॉब्लम्स उसके बाद बढ़ जाएंगी.
करेक्ट. तब थोड़ी सी है, इजीली ट्रीट कर सकते हो, वो एक रिवर्सिबल फेज में है, बहुत ज्यादा डैमेज नहीं हुआ होता. बट इफ यू इग्नोर इट, लाइक यू वेरी राइटली सेड रमन, अगर आप उसको इग्नोर करते रहोगे तो फिर वो छोटी चीज बड़ी हो जाती है. देन फ्रॉम द इन्फेक्शन व्हिच कम्स विल गो टू योर बोन एंड देन यू विल स्टार्ट लूजिंग बोन, टीथ स्टार्ट शेकिंग, वो सारे दांत हिलने शुरू हो जाते हैं, एंड देन दैट इज अ कंडीशन नोन एज पेरियोडोंटाइटिस.
ओके. So, can you recommend some mandatory oral hygiene habits?
Okay, so for daily purposes, everyone should regularly brush a minimum of twice a day. At least 2 बार brush कीजिए, and always use a
Okay.
soft brush. Don't use a hard or a medium brush because you'll end up damaging your gums and teeth more. So
Okay.
twice a soft brush, and if you need, if required, check with your doctor. They might advise you a mouthwash, but note
Okay.
all the people on the group that mouthwash is not a substitute for brushing. It is just an
Obviously.
adjunct.
Yeah.
No, a lot of patients come and say, brush में एक बार करता हूँ, mouthwash में रात को कर लेता हूँ. Does that make it
This happens.
easy ना?
So,
Lazy.
can you recommend some brushes to our audience as well?
So you have a lot of brands available in the market. You can choose from any one, but just ensure that you're buying a soft bristled brush. That is the recommendation. A soft bristled brush, and आराम से प्यार से कीजिए. There is a technique to brush. I'm sure you have so many videos on YouTube for the correct
Yeah,
brushing,
obviously.
so that हम बिल्कुल उन्हें घिस नहीं रहे हैं. Because अगर आप वैसे
Hmm.
करोगे and put extra pressure, you'll end up damaging your gums. वो होता है ना, gums ऊपर चले जाते हैं. That's the thing called recession. तो रिसेशन हो जाएगा, फिर सेंसिटिविटी होती है, देन इट्स एंटायर साइकिल व्हिच स्टार्ट्स. सो सॉफ्ट ब्रश आराम से दिन में 2 बार कीजिए. माउथ वॉश if it has been recommended, and if possible, very difficult for Indian population, but if possible, we all should learn how to floss our teeth at least once a day.
Okay.
Very very important.
Okay. हमारे पास कमेंट आ रहा है which kind of mouthwash?
So ideally, okay. Ideally, the mouthwash is going to be recommended by your doctor. The most commonly available mouthwash, आप किसी भी brand का ले लीजिए, but it has a component which is known as chlorhexidine. So
Okay.
chlorhexidine, safest component, जो हमारे जैसे कोलगेट के आते हैं बहुत सारे, डॉक्टर रेड्डीज के आते
Hmm.
हैं. So any of them can be used, but you should use it in the correct and ideal proportion. You can use whichever
Okay.
one. All of them have the basic composition as the same. It is the same for
Okay.
most brands.
Okay.
Somebody's
Uh,
asking soft brush if we have braces. No, no, no. If you have braces, then there is a different or a special type of a brush for braces. Once your braces get removed, then you can come back to the normal soft brush.
hmm. So उसके लिए भी okay, got it. And our last question, I hope you don't mind, काफी सारे questions हो गए हैं.
I'm enjoying it. Please go ahead.
Okay, great. So, how does our general health and dietary habits affect our teeth?
So all, since COVID has taught us a lot of
Hmm.
maintaining good, eating good food, healthy food, having a lot of roughage.
Hmm.
So if you maintain, if you want good general health, you have to realize we all ample have good food. Correct? The first key to good health is eating good food. But if you have
Yeah.
pain, or if you have a big cavity, you'll not be able to chew your food properly. If you're not chewing your
Hmm.
food properly, it's not going to get digested and absorbed properly. आप जितना भी अच्छा खाना खा लीजिए, आपको वो required minerals and vitamins आएंगे ही नहीं, because we're not chewing our food properly. So
Yeah.
overall, our health will get affected by default because our digestion is going to get affected. We should all improve our
Okay.
diet habits, maintain good hygiene, and then give big, bright, sparkling smiles.
Hmm. Yeah. So, anything else you want to add in this live session? Because I'm done with my questions and I'm sure कि हमारी audience के पास भी थोड़े बहुत questions होंगे. If you guys want to ask something with the doctor, then obviously please comment below, and obviously we will answer here. If you want to add something, doctor, please.
I think I would just like to send in a message to everybody that as a humble request, all of you should get regular dental checkups done at least once in 6 months. It is
Yeah,
very
obviously.
important. Do not underestimate the importance of your oral health. If you have
Hmm.
crooked or missing teeth, it is very dangerous and you should not have such things. If you have crooked teeth, please go get braces done. If you don't want braces because they show the wire is there and there are so many disadvantages and advantages of it, We have an amazing line of aligners which is available, which are completely
Hmm.
transparent. They're removable. You can wear them anywhere. Just carry them in your pocket, and they will keep correcting your teeth. And as far
Hmm.
as missing teeth are concerned, if you've seen so many patients come and they have 2-3 teeth missing, but they don't want to get it replaced because they feel there's no problem. But if you actually, on the hindsight, if you think it is creating a major problem, there should be no
Hmm.
empty spaces in your mouth. You should get all your teeth replaced. It is very, very important.
Yeah. We got a question from Aarti. What would you suggest someone who want to pursue dentistry?
Hi, Aarti. I think that's a great question. So, I'm a specialist, I'm a gum specialist and a laser specialist. And if anybody wants to pursue dentistry, you have to write in an entrance exam. And I think that's all that is needed. Then you can pick your college of choice. And it's a 5-year course followed by a 3-year specialization with a lot of fellowships and diplomas available nowadays. So yes, it is a great profession. It's a noble profession, and it's a good thing if you would like to become a dentist.
Great to hear you, Aarti. I hope आप जल्दी करोगे and thank you so much guys for joining this live session. I hope कि ये live session काफी ज़्यादा आप लोगों के लिए productive रहा हो and ऐसे live session हम आपके लिए बार-बार लाते रहेंगे. And thank you so much, Doctor, for joining in and letting our audience. I mean, काफी सारी information मिली उन लोगों को आपसे. So thank you so much. Thank you so much joining and thank you so much my audience for joining this live session.
Thank you,
Uh,
Raman, for having me here. It's an absolute pleasure to be here, and I'm wishing all the best to everybody. Take care of yourselves. Take care of your health, and thank you, Raman, again.
Thanks. Bye bye. Bye bye, guys.
Thanks.
We got a question. Clove is totally money minded. Till you pay, they will be keep you on calling. Once after paid and after first sitting, they will make you what like hell. Is it true? I don't think so.
It is not like that. No doctor would ever
No.
want a patient to.
Even I recently visited and I don't feel like कि ऐसा कुछ भी है.
ऐसे नहीं होता. I'm sure the person must have had a bad experience, but as an organization, as a company, we are very dedicated towards our patients, and I'm not just saying it. I work myself. It is the utmost priority to take care of the patient and ensure that the patient is treated well, correctly. That is why we have a very deep audit system. We have the set hierarchy so that everything and
Hmm.
everything is taken care of, and everything is very transparent. So you're going to
Hmm.
be shown okay, for example, before we even a very small thing like a small cavity. So we'll show you on the
Hmm.
camera that this is the cavity. Then we're going to prepare the cavity and take another photo to ensure that, the cavity has been prepared properly. And then we're going to do the filling of the tooth colored material and show you again in the camera. And these are all recorded and
Yeah.
documented as proof. That,
If you want to see the process, you can check out my recent video. I posted it a day before yesterday on the World Health Day, so you can check and मतलब पूरा process मैंने उसमें दिखा रखा है क्या कैसे होता है. So yeah.
And बहुत अच्छे से डिटेल में बताया है रमन ने, and very rightly he is mentioned. So we're very transparent.
Hmm.
You're most welcome to come again. I'm sure you're gonna have a great
We
experience.
got a more question. Battery powered toothbrushes are safe to use.
Yes, they are.
So would you recommend it?
Yes, they're absolutely safe to use, and now they are commonly available in India as well.
Yeah.
Yes, recommended. It is for specially patients who are medically compromised or debilitating condition. People who are manually not very dexterous can use it. For that matter, I myself use an electric toothbrush at home, but just ensure again it should be a soft bristled brush. That's the golden rule. And anyone and
Hmm.
anybody can use it. It's very easy, convenient, and for that matter, very affordable in India now.
Yeah, that's true. Uh, we are famous, but in Chennai and Hyderabad, this happens to me. After complaining, they called me to come. आई होप ब्रो कि आपकी वो प्रॉब्लम जल्दी मतलब सॉल्व होगी होगी मे बी कुछ ट्रबल हुआ होगा उस टाइम पे बट जहां तक मेरा एक्सपीरियंस है ऐसा नहीं होता है क्लोव डेंटल में बट एनीवेज हमारे डॉक्टर भी हमारे साथ एनी ब्रांड इफ यू कैन सजेस्ट फॉर
Oral-B is there, Colgate is there. These are the two brands which are commonly available in India for electric toothbrushes, and they give you good prices as well. So you can check it out on Amazon, or I think they give you good deals on Amazon. I got one from
Yeah.
there.
Priya commented, hello, please save this live stream. Obviously, I'll put it on my feed. You can check anytime, and जो हमारा live session है वो आप लोग कभी भी देख सकते हैं. Confidence to your phone. Thank you so much, guys. Thank you so much for joining. Lovely talking to you. Bye bye.
Thanks. All the best. Take care.